Hi, I'm Jason from BodyWorx Physiotherapy. We're just going to now demonstrate a knee taping for patellofemoral syndrome if you're having problems in behind irritation of the kneecap. So this is really good for people that have conditions like tight ITBs, have the actual patellofemoral syndrome where the kneecap's either rubbing too much on one side of the bone behind it or not enough on the other. So we want to try and just gently pull the kneecap inwards a little bit when we're doing this taping. So there's a few things that you need for this taping. I would recommend doing an undertape with a hypersensitive tape, sometimes known as Therafix, Fixamol, any of those. It's basically just because some of the skin around the knee is a little bit sensitive, so it's really good to put that on underneath. It also sticks a little bit better because it moves with the knee. So first up, what we're going to do is get a strip, and it's going to go from the halfway down the outside of the knee, right around, so that on the inside of the knee it tucks right under the edge. So we just measure that up roughly. Cut 2 strips of that. Placing that on the knee from there down. And once again, so you've fully covered the knee with the white hypersensitive tape. And now I'm actually just going to get my model to spin around the other way. So you've got your head up the other end of the bed. Cool. Just pop it back in there. Go. Okay, I'll get you just to hold that there. Perfect. Cool. So now, as you can see, we're looking at the inside of the knee. We've got it up on a towel, so you want to make sure when you're doing this tape you've got the knee slightly bent. Otherwise, when you finish taping it, you won't be able to bend your knee properly. So I've just got that with a slight bend. The more bend you require in your activity, so if you're going to be doing a really deep bend, you just put a little bit more of a towel underneath or a pillow to give it a bit more bend before you tape. Next up, we're going to use the rigid tape. So what we want to do is, first up, find the kneecap, which is right here, and then we want a strip to go straight over the middle. So we're going to attach it from the outside, pulling it over, and I'm going to use the thumb to touch just the edge of the kneecap, push it gently in, and then pull up with my other fingers, so you can see we get a bit of a crease through here, and then pull down with the tape. So we want a bit of a wrinkling or puckering effect on the inside. So normally when we do this, we'll do 3 strips, a little bit lower on the second strip, and then a little bit higher, just so we've covered that full kneecap area, just gently pulling each time so we get that nice little puckering in there. And then to finish off with just another strip of the hypersensitive tape. As we said, it's just hypoallergenic, so you're very unlikely to find someone to react to it, and it also sticks better to the skin. If you're doing this on a girl, make sure they don't have any moisturising cream on their leg recently, otherwise you'll need an alcohol wipe or something just to wipe it off, because otherwise this will come off as soon as you pop it on. So as you can see there, nice and pulled across. If you just spin your leg around for me, just off the edge. And so what we can see there is as it's bent, it's still staying in place, but it tightens up a little bit when you bend.